Diabetes is a common condition caused by a metabolic disorder involving the body's insulin hormone. The disease progresses silently and can lead to dangerous complications if not treated early. Recognizing the early signs of diabetes is crucial for timely treatment and preventing complications. In this video, we will explore how to identify the symptoms of diabetes. First, we need to understand what diabetes is. Diabetes is a group of diseases that cause a disruption in the body's ability to metabolize glucose. For the body, glucose is an essential fuel for generating energy for the cells to function. Normal blood sugar levels range from 70 to 100 milligrams per deciliter. However, for individuals with prediabetes, this level is between 100 and 125 milligrams per deciliter. For those with diabetes, the level consistently exceeds 126 milligrams per deciliter. Diabetes is classified into the following types. 1. Type 1 diabetes. This type occurs due to an autoimmune reaction where the body stops producing insulin, requiring patients to use artificial insulin daily and maintain it for life. 2. Type 2 diabetes. This type occurs when the body develops insulin resistance or the pancreas produces less insulin than normal for some reason. It differs from type 1 diabetes in that the patient's cells become resistant to insulin, meaning they do not respond effectively to it, even though the body is still producing insulin. 3. Gestational diabetes. This type occurs in pregnant women because, during this period, the cells become less sensitive to insulin. Not all pregnant women develop diabetes, and the condition may resolve on its own after childbirth. Dangerous complications of diabetes. If not treated early, diabetes can lead to dangerous complications. Stroke and cardiovascular diseases. Peripheral nerve damage, causing loss of sensation, pain, or muscle weakness, commonly affecting the hands and feet. Kidney function impairment, potentially leading to kidney failure. Eye damage, including vision loss and diabetic retinopathy. Increased risk of infections, including skin infections, urinary tract infections, lung infections, slow healing wounds, and a higher chance of diabetic foot ulcers. Digestive disorders, causing nausea, bloating, constipation, or diarrhea. Recognizing the signs of diabetes is very important. This will help you develop an appropriate treatment plan and prevent dangerous complications. Here are some ways to detect diabetes. Excessive thirst. If you are constantly thirsty, it may be a sign of diabetes. This is because when you have diabetes, your blood sugar levels are higher than normal. At this point, the body automatically triggers a mechanism to draw water out of the cells and release it into the blood to dilute the excess sugar. Naturally, this process causes the cells to become dehydrated. As a result, even if you had just drunk water or drink water continuously throughout the day, you still feel dry mouth and thirsty. Frequent urination. Another simple way to detect diabetes is by noticing an increased frequency of urination, which is directly proportional to how much water you drink. This is because the body is trying to expel the excess sugar, making the kidneys work at full capacity, causing you to urinate more often. Unexplained weight loss. If you are losing weight without changing your diet or lifestyle, it may be due to diabetes. This happens when an excessive amount of glucose is excreted in the urine. At the same time, the body is unable to convert food into energy, so it has to use energy from fat and muscle. Over time, this leads to fat loss and unavoidable weight reduction. In any case of unexplained weight loss, you should get a general health checkup to find the cause and receive appropriate treatment. Hunger and fatigue. Similar to weight loss, constant hunger and fatigue may be due to difficulties in energy metabolism and nutrient absorption. When your body lacks energy, you will always feel tired and weak. Poor nutrient absorption also makes you feel constantly hungry and crave food. Blurred vision. One of the complications of diabetes is vision loss and the development of eye diseases. If you suddenly experience blurred vision or eye pain without an obvious cause, it is possible that you may have diabetes. Weakened immune system. Diabetes weakens the immune system, reducing the body's resistance. At this point, you are more susceptible to infections and itching, especially in sensitive areas. Along with this, other symptoms of diabetes include numbness in the hands and feet or a tingling sensation like ants crawling. To reduce the risk of diabetes, you can refer to and apply the following measures. Maintain a healthy weight and avoid being overweight or obese, especially abdominal obesity. Spend at least 30 minutes each day exercising and engaging in light physical activities. Ensure a balanced, nutritious, and healthy diet with plenty of vegetables and fruits. Avoid fast food, processed foods, and fried or greasy foods. Starting at the age of 45, undergo diabetes screening every 3 years. For individuals who are overweight, obese, or have a family history of diabetes, consider earlier screening based on your doctor's recommendations. In conclusion, if you experience any of the symptoms mentioned above and suspect you may have diabetes, it is best to visit a hospital for a checkup. This is because these symptoms may not always be caused by diabetes but could be due to another health condition. Regardless of the condition, timely diagnosis and treatment are essential. If you found this video helpful, please remember to like, share, and subscribe for more health and wellness content. Thank you for watching, and see you in the next video.